Good afternoon. Thank you for inviting me to speak at the 2025 Alberta Dystonia Symposium. I would have loved to be there with you in Red Deer today, or at least offer a live virtual session, but alas, I'm busy with prior commitments. I hope my recorded presentation will convey some of the excitement I wish to share with you regarding physiotherapy for dystonia, with my presentation today titled Brain Training for Dystonia. Today, I'd like to speak about the challenges around finding a physiotherapist with experience treating dystonia. Regardless of who your physiotherapist is, there are many things you can do to enhance motor skill. So a good portion of this presentation will focus on motor learning and neuroplasticity. And finally, today, I will summarize the existing evidence supporting physiotherapy for dystonia and give a brief sample of what a treatment program could look like. Sadly, I cannot simply post a recipe for everyone in the room to follow, but hopefully after today's talk, you feel inspired to take charge of your motor learning to achieve relief from your symptoms.
Well, this is me. I graduated in 2008 with a bachelor's degree in physiotherapy. I've worked in a variety of backgrounds, with my longest experience being in outpatient neurology at the South Health campus. So for the past 13 years, I currently work for myself with Action Potential Physiotherapy, where I provide in-home and virtual services, and I work at a clinic in Calgary called Alberta Neurologic Centre. My focus has been in neurology over the past decade, so I've advanced my training in various areas, like acupuncture certification in Winnipeg, motor retraining for Parkinson's disease in Montana. I did vestibular rehab in Atlanta, MS training in Las Vegas. I've become a founding member of the FND Society, which has taken me to Louisville, Boston, and Italy for educational events and conferences. I use that education and passion for rehab to create Alberta's only FND program, and have published a study outlining those program benefits. My experiences and education have offered a rich pool of knowledge to draw from and provide care to my patients. I'd like to begin by discussing terminology regarding specialized physiotherapy. In our case today, the term neurophysiotherapy. Generally, a physiotherapist graduates with a bachelor's, master's, or doctorate degree in physiotherapy and is generally qualified to treat disease, injury, or deformity with physical methods. After graduation, we begin our advanced training, and ideally that continues throughout the entire career. A therapist would tend to engage in training applicable to their area of practice, so neurological training or courses for those working in neurology, or cardiorespiratory courses for those working in the ICU or acute care, for example. The postgraduate studies, that can be anything from article reviews, self-study, to weekend courses, conference, or full certifications. It's not quite the same as like a physician or a neurologist, like a neurologist, where there's specific training to achieve and earn the title. Generally speaking, the physiotherapist is trained to explore education and expected to do so to maintain their licensing requirements. Sometimes the area of work or interest becomes a way to describe the therapist, so like a vestibular physiotherapist or concussion physiotherapist or neurophysiotherapist. So that's more like a nickname based on their area of work. There are processes for physiotherapists to achieve specialist titles. So the Canadian Physiotherapy Association or American Board of Physiotherapists do have peer-reviewed exams or processes where a physiotherapist can become a specialist certified.
This is a visual representation of our Canadian clinical specialists from physiotherapy.ca. So to achieve the clinical specialist title in Canada, the process involves application if you have that 5 years experience in the area, and you need to demonstrate participation in research in the area. Then the candidate would participate in a case-based discussion with a panel of peers to demonstrate their knowledge in that specialty area. There's not really a specific course required or a specific examination process. The cost to certify as a specialist in any of these areas is around $4,000 and provides no increase in wages for the therapist or opportunity, rather is a simple label of formal recognition. Despite being obviously qualified myself, this is not a process I have chosen to pursue, as I personally believe the fee for this title could alternatively be directed towards several conferences multiple courses, or a certification program which would more directly benefit my patients?
Our Alberta Association of Physiotherapy has a Find a Physio section on their website. However, it's not a comprehensive list of all the physiotherapists. It's just the members of the association, and it's separate from our college, so it's not mandatory. So this is not a representation of all of the available therapists. When I searched by neurology, I came up with 11 therapists in all of Alberta, which is an obvious misrepresentation of who's actually out there. On the right-hand side here, the Dystonia Medical Research Foundation of Canada also has a directory, but again, the representation is quite limited. So there are obvious issues with collecting and maintaining a list of therapists who have specialized training because we don't have any standard benchmark or approach to defining that. We don't have a single list of all the physiotherapists in Alberta, so there's this challenge in creating and maintaining that list. So if you have your phones handy, take a picture of this slide so you've got this phone number. If you've got a pen with you, write this one down. This is the Alberta Rehab Advice Line. This was launched by AHS in 2020, and you connect with an experienced therapist from a range of backgrounds. They offer assessment of your needs and can guide you towards appropriate services, which may be available through AHS. When searching for a physiotherapist just online, you can read their bio on their website to get some clues about what type of interest they have, what kind of course, what kind of experience, when did they graduate. You may be able to find out if they're familiar with dystonia or call the clinic and ask a few questions. Do they have the willingness to learn? They may not have a lot of experience, but if there's someone who is able to take those steps for you, they'll be a good fit. There are online programs, which I do not have any specific recommendations about, just based on simple lack of knowledge on all of the available programs out there, but it can be a really helpful resource. They just sometimes lack the specificity or that individual feedback that's sometimes really required to make the most out of your time. So with funding, you may be able to find programs that are covered by Public Health or Alberta Health. You may have coverage for private physiotherapy if you have insurance, or programs like AISH or Veterans Affairs can cover. And check with maybe your pharmaceutical company. So if you receive toxin for treatment, Botox and Xeomin both offer financial programs. So if you receive Botox brand, there's a program called AbbVie, which provides up to $125 per session for a maximum of 4 sessions. Your doctor needs to help fill out this form, and in the box where it says special considerations, they need to indicate it's for physiotherapy services. With Xeomin brand, they have what's called the Access Advantage program, and you're eligible for $250 per year for therapeutic services or medical devices. So it could be physio, OT, massage, or it can be equipment like braces, canes, crutches, adaptive equipment. Hopefully your neurology office is familiar with these programs, because I don't have intimate knowledge on exactly who to send the forms to or where to enroll in these programs. So hopefully you can find out a little bit more with your healthcare team. Now, hopefully, before we switch topics, I haven't lost anyone with that somewhat depressing talk about how challenging it can be to find a good physiotherapist. But next, I'd like to focus this talk on how we can train our brain to manage dystonia symptoms. I'd like to discuss a term some of you may be familiar with, neuroplasticity. This is the brain's ability to reorganize itself by structure or function in response to experience, disease, or injury. So basically, it involves changes in the strength of existing connections, as well as the creation and elimination of synapses. Neuroplasticity enables the brain to rewire itself, so constantly adapting to new information and challenges. Neuroplasticity can be helpful, like when we learn a new skill, or it can be unhelpful, as in the case of dystonia. So to review, dystonia results from abnormal functioning of our basal ganglia, a deep part of the brain which helps control coordination and movement. These regions of the brain control the speed and fluidity of movement and prevent unwanted movements. The exact cause of dystonia is not yet known, but may involve alteration in several regions of the brain or communication between the regions. Dystonia may develop because the brain misinterprets sensory information and then also fails to properly control the muscle activity through its usual braking systems. These problems can happen at many levels in the nervous system, including our spinal cord, brainstem, cerebellum, basal ganglia, and cortex. Over time, these errors lead to faulty rewiring of the brain networks, known as abnormal plasticity. This gradually affects more areas of the brain and body, which is maybe why spreading miscommunication results in the involuntary movements and postures seen in dystonia. When you hear the term sensory motor, we are referring to the relationship between sensory information, so what we feel, what we detect, and motor control, our movements or our output. So a child's developing brain is much more plastic than our adult brain because their neurological pathways are not strongly reinforced yet. However, neuroplasticity can happen at any age and at any stage. It's just we may need to work a little harder at it once we're in our adult years. And so these are a few things that we can try to manage to ensure we promote neuroplasticity. So positive social connections, physical exercise, meaning, adequate sleep and nutrition, practice, focus. Exercise offers many benefits to our overall learning. It promotes blood flow to our brain, delivers nutrients. And so it's a really important piece of promoting neuroplasticity.
Skill building or learning is critical for performance in many areas and therefore an area of interest for researchers. One interesting theory is the optimal theory, which focuses on what a learner wants to do and how movement can achieve that goal for them. The four main components of this theory are self-efficacy, expectancies, autonomy, and attention. So I'll talk about each one briefly. Self-efficacy is our confidence, and it's shaped by our knowledge or experience with a task. Studies show higher self-efficacy enhances performance in the skill. In a study of individuals tossing a beanbag to a target, one group received positive feedback in the form of feedback about their 3 best throws, and the other group received feedback about their 3 worst throws. The group provided with positive feedback achieved better accuracy overall in their throws compared to the group with negative feedback. So positive experience and feedback impact our self-efficacy to improve performance. This confidence ties into the next point, expectancies, which develop based on our previous experiences. It's thought these positive feelings about our expected performance trigger a dopamine response, which is associated with reward, motivation, and meaning. Meaning if you feel positive, you'll more likely repeat the behavior, which enhances your motor learning. Autonomy is the degree to which we feel we have choice or control in a situation, and it plays an important role in our learning. Attention. Numerous studies have shown us that external focus of attention leads to more effective motor learning. So for example, retraining somebody to grasp after a stroke is more effective when the training is focused around a target, such as picking up a glass, compared to performing simple hand exercises. So having an external target to reach for enhances their learning.
So visualizing your task can actually promote learning and performance. So in stroke rehab, patients who practice mental imagery showed significantly better arm function compared to those who performed just the physical practice. There's also a famous study from the 80s looking at college basketball players where they evaluated mental practice on their skill. And the skill for these players was free throws. They randomized the players into 4 groups, one with physical practice only, one with mental practice only, one with combined, so mental and physical, and one who did no practice at all. All groups improved their performance, but the mental and physical group combined improved the most. Mental practice alone was also shown to be better than no practice at all, but not quite as effective as physical practice. So simply visualizing yourself performing the motor skill enhances your performance. So when I say motor learning, I'm referring to a set of processes that's based on those principles of neuroplasticity. It's associated with practice or experience that leads to relatively permanent motor changes, so like learning a new instrument. So motor learning has been extensively studied, resulting in a few main principles to guide us. So those include intensive rehab, progressive increase in difficulty, salient or meaningful intervention, and feedback of knowledge or results performance. So first, speaking about repetitions, what is high repetitions? So one study looked at participants performing a novel task, which was controlling a robot arm with a joystick to get the arm to reach a target. And they found that with this new task, new skill, up to 200 or even 300 trials were required to achieve this skill, which they measured by accuracy and speed to which they could get the robot arm to the target. So aiming to achieve as close to the high end of this recommendation here, where you're looking at 10 to 20 repetitions up to 5 times, trying to perform a total of maybe 30 to 60 minutes of practice per day. You want to try to get to the high end of that to the best of your ability when learning a new motor skill. So progression, basically the task needs to become gradually more challenging to encourage further skill acquisition. So we want to gradually increase the complexity here. At first, things may need to be very slow and very basic with limited distraction. And then we might start increasing repetition, maybe getting a little bit faster. Can we start to maybe change the practice setting? So instead of lying down, maybe we're sitting up, maybe we're standing. Can we add a dual task or a distraction? Can we do this in a busy environment? So varying the conditions. And you're aiming for a progression where you can still achieve success 70 to 80% of the time. So salience, your brain is constantly filtering out irrelevant information. So when a task is meaningful, your brain can allocate more attention to it, which supports neuroplasticity. Remember, we learned that in the optimal theory. So that meaningful task boosts your brain's ability to learn, and it also allows that task or that practice, that exercise, to more easily transfer into daily activity, daily life. So feedback. This gives our brain information about how well it just performed the task. So we have intrinsic feedback, which is our own feelings. How did that feel? Did that feel a little bit easier? Were we faster? Or extrinsic feedback. So this could be watching yourself move, using touch to determine where you've moved. And so early feedback is helpful because it will limit practicing poor form or poor technique. But gradually we want to reduce that feedback so that the process of motor control becomes a little bit more automatic. So rewards, our brain loves a reward. This can be as simple as money or a verbal job well done for achieving the task. Using rewards integrated into rehabilitation has the potential to improve the efficiency of recovery and help maintain motivation for the gradual rehab process. So rewards release dopamine, which strengthens those neural connections and leads to better learning of that rewarded action. So our brain wants us to repeat the activity which earned us the reward. Studies have looked at reward versus punishment for reinforcing learning and consistently show that rewards lead to greater motor performance when compared to punishment. In a group of participants studied performing a motor sequence with and without performance-based rewards, the group that performed the task with rewards were able to demonstrate better carryover even after sleep. So returning to the novel task the next day, they were able to perform better than the group that did not receive rewards. This means to me that reward helped to keep the information locked in that nervous system for a longer period of time, so consolidated the learning. Now, I'd like to shift my talk to highlight some of the evidence for physiotherapy as a treatment for dystonia. With cervical dystonia being more common than other types of focal dystonia, much more research exists on this topic. Strong evidence supporting physiotherapy for dystonia is lacking. The studies available look at different approaches, different treatments, different intensity or frequency of the treatment, and we have different outcome measures.
Additionally, studying enough people with dystonia is challenging due to the relative rarity of the condition. For those who may not be aware, a randomized controlled trial, or RCT as I'll refer to it moving forward, is a scientific study in which a group of participants are randomly assigned into two groups. One group is the experimental group where the intervention is applied, and the other is the control group which receives no intervention. Then we evaluate the difference between the two after the trial period. Systematic reviews are when the authors look at the available RCTs to evaluate overall evidence. So one such review was completed on the topic of cervical dystonia in 2014. Another group repeated one in 2022, and the same group from 2014 has published one again in 2024. So overall, with those different reviews, they highlight about 15 randomized controlled trials looking at the effectiveness of physiotherapy for cervical dystonia, which is not very many RCTs over the past decade. We don't have much evidence. This here on the screen is the most recent 2024 review, which included 8 RCTs, and I'd like to take a moment to highlight some of the key findings. This is a summary of the 8 RCTs, or randomized controlled trials, used in the 2024 review. So looking at 340 participants across Italy, UK, Netherlands, Thailand, Turkey, across the world. They studied stretching, relaxation, massage, home exercise, biofeedback, taping, strengthening, so a variety. Most of the studies were designed around the use of the gold standard Botox treatment for dystonia. So some of them are looking at improvements as a result of Botox by itself compared to Botox plus PT, but most participants in any of these studies are additionally receiving Botox. All of the studies here summarize significant improvements in pain and disability. So disability meaning how much do these symptoms interfere with daily life. To point out a couple of cool ones, so WHO, the second one down there, they found improvement in pain and severity after a 6-week daily home program with stretching, range of motion, and strength, which was started after just one physiotherapy session. Council, the next one down, they were able to show that specialized PT compared to standard PT showed no difference. There's no difference between the PT types when it came to the outcomes achieved for cervical dystonia. So they compared a specialized program called the Bleaton technique developed in France to standard physiotherapy advice and treatment for just generic neck issues. Both of them were delivered weekly for 24 weeks. The Bleaton technique focuses on sensory motor learning principles with postural exercises, therapist-guided movements, sensory feedback to encourage movement in the right direction, active movement training, and task integration, or kind of like real-life practice, which sounds familiar based on what we just learned about all of those important bits for neuroplasticity and motor training. The Bleaton technique training is not specifically available in Canada. However, we do have access to, it's called a Dystonia Physio Exercise Hub, and so it's a digital platform which is developed in collaboration with Jean-Pierre Bleaton. So this resource is designed to help us PTs with an exercise database aligned with his technique, so we can use that to prescribe to our patients. The RCT from the review with the strongest impact on pain is the article by Tassarelli et al. This figure demonstrates pain rating scales using a common standardized outcome measure in cervical dystonia. In the study, 40 adults with isolated cervical dystonia were randomized into 2 groups. 20 received toxin alone, and 20 received toxin and multimodal physiotherapy. So the physiotherapy program was 10 weekly sessions shortly after the toxin injection and included stretching, deep massage, biofeedback training, and strengthening exercises. So the gray bars are the pain ratings before the treatment, and the blue bars are the pain ratings after. The left 2 bars is the group who had toxin only, and the right is the combined PT and toxin group. So pain decreased in both groups, but significantly more in the PT and toxin group, about 50% greater reduction in pain rating. Disability also improved more in the combined group compared to toxin alone, and patients in the PT group
actually required lower toxin doses at follow-up, so they experienced longer benefit between injections. We do have some randomized control trial evidence for writer's cramp or focal hand dystonia, which the interventions include motor retraining, often occupational therapy, and again, partnered with Botox. And even here, the results show meaningful clinical improvement, especially in those objective measures. But essentially for other types of dystonia, we're really lacking this type of study or evidence to support physiotherapy. What we do know about rehabilitation, to summarize, is it does seem most effective when combined with the botulinum toxin injections. So it's best to get work shortly after the injection when the toxin is taking its greatest effect. Keep working at it. We don't have an optimal duration for rehab. The different studies looked at a wide range of treatment durations, treatment intensities, treatment frequencies. So we don't have the optimal recipe quite yet. We don't have many specialist physiotherapists, but evidence does show you can still access quality care without one. So speak with your physiotherapist about your symptoms and work together to come up with a plan. Generally, exercises should re-educate your posture, strengthen your weak muscles, and lengthen or stretch the tight ones. So briefly going through this is what it would look like if we were trying to initiate our treatment program for cervical dystonia as our example here in this case. So finding our physiotherapist, we've learned that was challenging. We've also learned that it doesn't take a lot of one-on-one physiotherapy sometimes. There doesn't seem to be a major difference between specialized physiotherapy approaches and maybe more standard physiotherapy approaches. So a therapist who is willing to learn about dystonia may serve your needs very well. You'd like to typically stretch tighter muscles, strengthen weaker muscles. I would generally recommend controlled movement exercise, so skilled movement, specific movement, and I would also perform sustained postural practice. So the movement and posture piece is really where the motor learning principles apply, so more of those high repetitions. I would recommend you set a small but meaningful goal. So that's that salience piece. I want to be able to turn my head when I reach into the drawer in my kitchen. And then you want to prepare your brain. So that's that positive outlook. Achieve regular exercise. A brisk walk, 30 minutes, 3 days a week is enough to give your brain those neuroplasticity boosts. So remember, your attitude or your mindset about the exercise you're going to engage in will impact your motor learning. So it can be a good idea to take 1 or 2 minutes to just perform some relaxed breathing, release some tension, reduce the stressors, and you can even use this time to mentally practice what you're about to do, which can also boost your confidence or self-efficacy. Start in a position where it's easiest to move and slowly progress from there. So I'm looking to perform 15 minutes of exercise 2 to 4 times a day. So if I'm practicing a movement, so let's say I'm trying to bring my ear towards my opposite shoulder, I'm going to perform that 10 to 20 times and repeat that 5 sets. For feedback, I can use visual, so looking in the mirror. I often use head-mounted laser pointers like what's being shown in the photo here. So as she moves her head, the laser projects down onto a target. I can use resistance bands to give me more information, more resistance, and then I would gradually reduce the amount of feedback. It's important to have fun with that program, and remember, you can use rewards to reinforce your learning, so maybe having a little pile of money that you pull from every time you perform all of your exercises. Thank you so much for your time today. I really hope you learned something from my talk today. And I would be happy to take your phone calls, your emails. If you do have any further questions or would like to discuss more, you can find more information about me on my website at Action Potential Physiotherapy. And you can learn about the clinic I work in, Alberta Neurologic Centre, at their website, ancentre.ca. For those of you interested in articles or resources like that, I have provided a list of references here for your information. Thank you for your time.